My name is Nitusima Kataraya. I'm a software engineer at D3. Today, wanted to present about one of the projects which we have done here at Zanzibar, which try to integrate machine learning with the CHT platform. Yeah, so I will get into details a little bit in the next slides, but just a quick overview. The idea which we had was to use machine learning here in Zanzibar with Jamii ni Afya program, which is a government program, community program, with the aim of to utilize machine learning to help us in personalizing and improve perinatal healthcare here in Zanzibar. The project is started February 2020 and ended on May 2022. It was rolled out in two districts, two northern districts, North A and North B here in Zanzibar. And it included 186 CHVs and 20 supervisors, and involved about 847 pregnant women. Yeah, so a quick overview of Jamii ni Afya. So this is the national program here in Zanzibar. It was launched on 2019. And the program has already covered the population of around 90%. We have about 2,300 CHVs who are supported by their supervisors, who are about 220. And these are like health facility workers, government employees who are working with the program. We have presence in all 385 shahias here in Zanzibar, and all 11 districts are also covered. And our CHVs are using mobile apps on a smartphone, which is powered by Community Health Kit CHT. And some of the services which the CHVs provide to the communities are ANC, PNC, referral, immunization, ECD, etc. Yeah, so machine learning in Jamii ni Afya. So this Jamii ni Afya program, we wanted it to incorporate the machine learning into it, meaning like we wanted to integrate the model with the app, and in order for us to accomplish the following. We wanted to contribute in improving the access to the quality essential to MNCH, maternal, newborn, and care health services for population which are at risk. And the approach was like we decided to integrate the machine learning and do predictive analysis to the Jamii ni Afya application in order for us to be able to predict high risk of negative pregnancy outcomes. So this will be high risk of perinatal mortality. So we needed the app with the help of machine learning to identify women who will be provided with tailored support CHV care to reduce the risk of perinatal care. So this was like the high level idea which we wanted to accomplish. To explain a little bit on how we went about trying to achieve that, the idea was to have CHV enroll pregnant women by doing a visit and then conduct a manual risk assessment. So we discussed together with our colleagues from the government and from the health sector, who identified some of the risks which we could include in the form, and how the CHV is able to identify a pregnant woman based on those criteria. And in addition to that, once the CHV has finished filling the form during the visits, and when he submitted it, we wanted to run the machine learning model on the background in order to detect those clients who had risks, but were not like being picked by the manual assessment. Like, so machine learning will do things like associative variables, which a human might not immediately think these are relevant. So yeah, so that was the main idea. And if the client is high risk, then the app will schedule additional visits, and the CHV will provide tailor-cared in follow-up visit. The idea were like to have 3 more additional visits if necessary, whereby the CHVs will visit a client and discuss about the known things which might lead to high risk during pregnancy or delivery, and then wanted the client to try to recite, and if we're reciting them correctly, we assume that the client has already been familiar with those, and also provide additional messagings around the facility delivery and nutrition and stuff like that. Yeah, so the workflow within the app, still high level, but I'm trying to dive a little bit, was, if you could see, reading starting the left-hand side, the data recorded during the visit. So during the visits, a CHV will do the manual risk assessment and normal visits and capture everything, and will provide a summary. So here you can see, like in the slide, you have an example where a woman was identified to have the pregnancy risky of using local herbs. So the message will be, you have high risk because of the local herbs, and then additional visits will be scheduled. But if it doesn't pick up the woman due to the manual risk assessment, then here we have in the center the model, which will work offline and predict whether the woman is high risk or not. And then as a visit will be scheduled, like you can see on the bottom of the screen, Susie Andrew Rumuka will have pregnancy counseling visits because the machine has identified them as having high risk. And on the right of the slide, you can see like the model would use, in addition to the informational risk criterion within the form. So this will be other data, which are like Shehia level data, which are aggregates, which play or which contribute to the high risk of the pregnancy women. So the machine will make sense of that and include it in detection of the risk. So we had a way of inducing this within the app, and feed it into the model. So the 3 things will be fed into the model, which is represented by the gear there, and the model will spit out a risky or non-risky classification. Yeah, so during this project, we encountered various challenges, and we learned a few things. Some of the challenges were due to the version of CHT which we used. So we found out like CHT was limited. Didn't have like some of the, this kind of use case was not like well supported to some extent, but overall it was useful and it is supported. One of the if I can quickly go through these, I could say like the first challenge was the model size, because the model was like huge, and we had to incorporate it within the mobile app, and we had to minify it and do a lot of stuff with the preparation of it, and still we couldn't be able to compile it in a normal way. We had to use a debug mode, and then we were able to release it. And another challenge was the framework did not provide a clean way of selecting only a part of society. So as I've said earlier, this project was intended to only take part on 2 districts, and we ended up releasing it to the whole of Zanzibar, though was only activated to only those 2 districts. And another challenge was it couldn't run the model. We couldn't run the model within the form itself and include the result on the same form. We had first to submit the form, and then after submitting the form, run the model on the background and predict the risk. So yeah, so we didn't have like a way of messaging during the same visit the outcome or something given by the model. So some of the lessons which we've learned that the models can be integrated in smartphone and can work well offline. So this was part of learning when we were trying to test ideas, and we were not sure like whether this would work well. But as it turned out, it worked well, except during the initial compilation phase. But once we released it, it worked seamlessly. And it gave us the idea that this approach can be used to assist us in prioritizing and personalizing care. And it is another lesson which we learned because we were trying to predict a health outcome. And because there were like a lot of factors which also affected it, then it turned out that it is more useful to predict behavior change, behavior instead of trying to predict health outcome. If we could like have a model which predict whether a woman would go to the hospital or not, that would look more promising than trying to predict whether she will have like a perinatal death or not. Yeah. So I think this is what we wanted to share with you today. And yeah, I think maybe on some of the challenges, we get in touch with the medic team, and they put together this CHT extension library, which will address some of these challenges.
Right. I'll read the questions, Nitu, and maybe you can address them. So the first question is the interface between, please clarify the interface between the model and the CHT app and where the model resides. And then there's another question of the source of data used to train the model.
Yeah, so the model was like compiled and minified in a JavaScript. The original model was trained on Python, but we transpiled it to JavaScript, and we minified it and included it as a function in one of the nulls. So it was just a file which was referenced in the nulls. So the interface was just a function, JavaScript function, which accepted the input of the model directly from the form. As to the source of the data used to train the model, so the model was trained with our partner at Nottingham University, the NLab. So they are the ones who like have the source data of the model and everything. They gave us the they gave us a Pico file of Python, where that is what we work with.
Thank you, Nitu. I'm also seeing Patrick clarifying that I think the data may be integrated, or the model may be integrated with in the form with extension libraries. And that's amazing, because the next presentation is actually by Josh, who will be taking us through the extension lib. Go ahead, Josh.
Yeah, Patrick is right on the nose there. And actually, the two presentations are connected. So first of all, my name is Josh Kuster-Steffen. I'm a software developer here at Medic. And I want to real quick just give a demo of the extension libraries, which was something that we developed in collaboration with Nitu and Imran and the team there to address some of the pain points they encountered as part of this machine learning rollout. So there wasn't a existing way to easily sideload the machine learning model into the CHT app, and so they were able to work around it, but it wasn't very clean. And then, like Nitu mentioned, even with their workarounds, there was no way to easily get feedback within a form. And so, real quick, we've promoed extension libraries before, but I'll just take you through a really simple example of what you can do with some extension library code. Here on the screen, you'll see I have created a file. It's called uppercase.js, and it basically is a function where you can pass it a string, any kind of string message, and it's going to return that message in uppercase. So essentially, I'm just trying to create a really simple example of let's do some functionality on a string where you pass data in and you get data back out. In this case, it just should convert every character in the string to uppercase. I've added this to my config folder, and then I can real quickly upload it to my CHT instance using this upload extension libs action via CHT-conf. And now it is live out there on my application. To use this in a form, it looks like this. Essentially, in your calculation field, you can call this new extension lib xpath function that we've added. You specify which extension you want. In this case, it's going to be the uppercase, and then you can pass it a value. So real quick, in this form, all it does is it has a string question that you get a message. We're going to pass the message to my uppercase function, and we're saving that as a new value in this calculate field, and then we'll display both of those in the summary. And so if I come in here and I fill out my message, you will see that the JavaScript code in my extension library function that I was just showing you is what was triggered and caused this message, which I entered in mixed case, to be converted into all caps. So live during the form being filled out, that JavaScript code in your extension gets executed, and it can return a value back to the form that can also be saved there. The advantages of that are multiple, and it's not just in the forms. So it's great that it's accessible in the forms. Additionally, though, the function from your extension library is also available in things like your task configuration, target configuration, and in this case, I'll show you in my contact summary configuration. So one of the things you can do is use the CHT API here in your contact summary configuration, call this get extension library function, and here's my uppercase, which I can then use as a part of the rest of my contact summary config. In this case, what I've done is I've just exposed two new fields on my contact summary that you should be able to see when I submit a message. One of them is going to be the message itself, and then one of them is going to be the uppercase message, which if I go ahead and submit this, you'll see here the message itself, and then I called the exact same function to set up these fields in my in my summary as I was using in the form itself. So essentially, not only can you share logic in an extension library between forms, but you can also share it between other parts of your configuration so that you don't have that duplicated logic everywhere. One of the huge advantages of doing it that way is if you find out you need to change the logic. So maybe you don't want it to be to uppercase, you want it to be to lowercase. You only have to change it in one place and then upload your configuration again. And if I come back here and I refresh and the live demo works, then now my message is automatically recalculated by calling that new function, and we're back to lowercase. So really simple example here with uppercase to lowercase, but it could just have easily been plugging in the machine learning model from D-Tree and being able to do some more complex analytics on that kind of thing.